I actually started preventative screening at a young age because of our family history. To be honest, I felt like surgery was quite invasive for what I needed at the time, and I was really comfortable having the preventative screening, which was every 6 months. I would have an MRI or a mammogram every 6 months, and I did that for several years. I decided to do the genetic screening, found out a few days after that there was some concern for a cancer in the left breast. So I was a complete wreck after that. I had a lot of different emotions going on, a lot of regret that I should have maybe done this sooner. But in the meantime, I had met with Dr. Reconstruction. We still didn't know if this was cancerous or not cancerous. Ended up having a biopsy later that week, found out it was benign, so that was like the biggest relief ever. But it really brought me to the conclusion that I was 100% ready to make the decision to have the preventative mastectomy and then do the reconstruction as well. I was referred to Dr. Reconstruction specifically, and I definitely looked into her, after I was referred. I asked around, to people in the community and heard nothing but wonderful things. She was so patient with me. I feel like I always had a million questions, her and her team. So her nurse practitioners, her nurses here at the clinic, everyone is just so wonderful. Emotionally, it was definitely a roller coaster, but I talked a lot with my husband, with my friends and my sisters, and just tried to educate myself so I was prepared and ready. And just asked tons of questions, even the ones that are, uncomfortable to ask. I think the best support was my family. They were incredible. My husband, and we have 5 kids. They all pitched in where and how they could. I have 2 daughters, so one would, help me do my hair and brush my hair because I couldn't move my arms. The other one was more hands-on. She wanted to help empty the drains, twice a day. And my team here at Aspirus, I came in for weekly appointments for quite a while with the expansion process. So every time they just, would answer all my questions and prepare me for the next step. So I would say that if you're considering breast reconstruction after a mastectomy, after a breast cancer diagnosis, just listen to your body, ask lots of questions and figure out what's best for you in the end, and that's going to be the right choice for you.